So now we are moving to the 38th page. So starting with the Sangraha Kala. Okay. So Sangraha Kala means like it, at what all the times you have to collect the parts of the drug. Okay, so each acharya they have mentioned, if you wanted to collect the fresh leaves, if you wanted to collect the flowers or the seeds, okay, so this type of things whenever you wanted to collect, so there is particular time each acharya has mentioned. According to Charaka, moola, okay, moola of the plant should be collected in the Shishira and Grishma Ritu. Okay, Nudana Patra Shaga, like the new leaves, okay, new leaves and the bark of the stem, these are all should be collected in the Varsha and Vasanta Ritu. Okay, Chala Kanda Kshira, these should be collected in the Sharat Ritu. Okay, so Chala, Kanda, Kshira, these should be collected in Sharat Ritu. In that, Snuhi Kshira should be collected in Shishira Ritu has mentioned. Okay, then Sara should be collected in the Hemanda Ritu, and Pushpa and Phala, these should be collected in the Yadha Ritu. Like whenever the flowering season is coming, whenever the season of the fruits, okay, whenever that fruit will be obtaining, so that time you have to collect it. So these are the timings, or these are the seasons where you have to collect the parts. Okay, so because in the formulation we need patra, we need phala, and we need the moola of the parts. Okay, so each thing should be collected in the specific ritu. So moola should be collected in Shishira Grishma, and patra shaga should be collected in Varsha and Vasanta Ritu. Chala Kanda Kshira should be collected in Sharat Ritu. In Kshira, Chala Kanda Kshira, so in that Kshira, Snuhi Kshira, it is obtaining in the Shishira Ritu. Then Sara, Hemanda, Pushpa and Phala Yadha Ritu. Whenever the flower is happening, whenever the fruit is obtaining, so that time you have to collect it. So these are the seasons where you have to collect the parts of the plant. Okay, Raja Nigandu. Okay, so according to Raja Nigandu, Kanda should be collected in the Hima Ritu. Hima Ritu means Hemanda Ritu. Okay, Kanda should be collected in Hemanda. Moola should be collected in Shishira. Pushpa and Phala. Okay, he has mentioned Pushpa and Phala should be collected in Vasanta Ritu. Okay, like Charaka is telling Yadha Ritu, whenever the flower is happening, whenever the fruits are coming, so that time only you should be collecting. But Raja Nigandu is telling Pushpa and Phala should be collected in the Vasanta Ritu. Okay, then Pravala Patra, okay, like the new leaves, when you have to collect it in Nidada Kala. Okay, Nidada Kala means Grishma Ritu. Nidada Kala is Grishma Ritu. So that time you have to collect the Pravala Patra. Panjanga, very very important. So he is the Acharya has mentioned about the Panjanga. Okay, so Panjanga should be collected in Sharat Ritu. Okay, so that is mentioned by Raja Nigandu. So Panjangas of the plant should be collected in Sharat Ritu. Okay, so these are the Sangraha Kala according to Raja Nigandu. Okay, Nidada Kala is Grishma Ritu. Next one is Sharangadara. Okay, he has also mentioned the Sangraha Kala. He has mentioned that the drugs which is used for the Vamana Virejana. Okay, for Vamana and for Virejana, whichever the drugs you are going to use, that should be collected in the Vasanta ke Andame. Okay, like end of the Vasanta Ritu. Okay, end of the Vasanta Ritu you should be collected Dravyas which is used for the Vamana and Virejana, and rest of the other procedures the drug should be collected in the Sharat Ritu. Okay, so these are the important Sangraha Kala. Okay, so according to Sharangadara, the drugs which is used for the Vamana and Virejana should be collected in the end of the Vasanta Ritu, and for rest of all the procedures or whatever the medicines you are preparing, for that drug should be collected in the Sharat Ritu. Then next one is Sira Onka Moola. Okay, that Moola Sthan of Sira. According to Sushruta, the Moola of Sira is Nabhi. According to Vagbhata, it is Hridaya. Okay, that is a location of the Sira. Next one is Vrana Ashraya or Vrana Vastu. Okay, Vrana Vastu, the term is mentioned by Sushruta. So Vrana Vastu, Vrana Ashraya, Sushruta, Charaka both are telling 8 locations where the Vrana usually happens. Okay, Adhishtana. So the where the Vrana will be happening according to Sushruta, according to Charaka, 8 in number. So which are the 8 locations according to Sushruta? Tvak Mamsa Sira Snayu Asti Sandhi Koshta Marma. Okay, according to Charaka also same thing only. Tvak Mamsa Siras Nayu Asti, instead of Sandhi he has mentioned Meda. Then Koshta Marma. So rest are all same, only the difference you will be getting Sandhi, instead of Sandhi he has mentioned Meda. Okay, this is the only difference you will be getting related with the Vrana Ashraya and Vrana Vastu. Next one is Amashestha Sleshma Shesha Kafonka Poshana Deta Hai Sushruta. So Sushruta is telling there are 5 types of kapha dosha is there in our body. So in the 5 types of kapha, Amashestha Sleshma, the kapha which is present in the Amashaya, that is giving nutrition to the rest of the 4 kapha doshas. Okay, so Amashestha Sleshma, that is giving poshana to the remaining 4 kapha, that is told by Sushruta. Okay, Charaka is telling Trikastha Sleshma. Okay, the Sleshma which is present in the Trika Pradesha, that is giving nourishment to the remaining 4 kapha. Okay, Sushruta is telling Amashestha Sleshma and Charaka is telling Trikastha Sleshma. These Sleshmas are giving poshana to the rest of the 4 kapha doshas. Okay. Next one is Sreshta Anjana. Okay, which one is best Anjana? According to Charaka, Savira Anjana. Savira Manjanam Nityam Hidamakshnastado Majit. Like that we have studied no sloka. So that we can use it for daily purpose. Savira Manjanam. Sushruta is telling Srodo Anjana. Okay, Charaka has telling best Anjana is Savira Manjanam. So that we can use it for daily purpose. Sushruta is telling Srodo Anjana. Then Varsha Ridu mein Sevana Yogya. So in Varsha Ridu, it is actually very rainy season. Most of the things are very contraindicated in this season. It is very it's very difficult. Treatment also we can't do in the Varsha Ridu. So what are the things we have to use during the Varsha Ridu? Very easily dosha prakopa used to happen. So Charaka is telling during the Varsha Ridu, we should take Amla Lavana Snigdha Sevana. Okay, Amla, Lavana, Snigdha Sevana should be taken during the Varsha Ridu, and the water should be, we have to use it from the Kuba. Kuba means well. Okay, W-E-L-L, well. So the water from the well should be taken during the Varsha Ridu. Okay, so the food particles that should be predominant with the Amla, Lavana, Snigdha Sevana, and that water should be collected from the Kuba should be taken during the Varsha Ridu according to Charaka. But according to Sushruta, Kadu Tikta Kashaya Sevana has mentioned. Okay, Kadu Tikta Kashaya Sevana has to be taken during the Varsha Ridu, and he is telling Andariksha Jala has to be taken during the Varsha Ridu. Okay. So these are the 2 things which is told by Charaka and Sushruta in Varsha Ridu. Next one is Shodha. Okay, swelling we used to get, no, Vada, Pitta, Kapha predominant, Shodha we will be getting. So Vadaja Shodha, Kaphaja Shodha, how we can differentiate? Vadaja Shodha, Divavali. Okay, which means if it is a Vada predominant swelling, if you are getting in the body, so the swelling will increases in the daytime. Okay, Kaphaja Shodha, if due to the Kapha dosha if you are getting swelling, and the swelling will be increases in the night time, Ratri Vali. Okay, so this is the main important feature for identifying Vadaja Shodha and Kaphaja Shodha. Vadaja Shodha is Divavali, it will increase, swelling will increases in the daytime. Kaphaja Shodha, it will swelling will increases in the night time. Next about the Yoni Vyabhat, 20 types of Yoni Vyabhat is there in our body. So in that, Karnini and Ubapluda Yoni Vyabhat is basically Vada Kaphaja predominant condition. Okay, Karnini, Ubapluda, Yoni Vyabhat, these are all formed due to the Vada Kapha dosha. Paripluda, Vamini, both are happening because of Vada Pittaja doshas. Okay, dosha predominance of Yoni Vyabhat is very important. So Karnini, Ubapluda, it is caused due to Vada Kapha. Paripluda and Vamini, which is caused due to Vada Pitta dosha. Okay, next one is very important. Pradimarga Harana Chikilsa. Okay, Pradimarga Harana Chikilsa, it is indicated in the Rekta Pitta. Very important. Most of the time we used to get questions related with this. Okay, Pradimarga Harana, that is indicated in which condition? So Pradimarga Harana Chikilsa is indicated in Rekta Pitta. In Rekta Pitta, what is the treatment protocol? If it is Urdhvaga Rekta Pitta, which means the bleeding is coming from the upper part of the body, then what treatment you have to do? Vireja. virejana karma, because opposite thing we are doing, right? We are getting bleeding from the upper part and you are giving the procedure is virejana karma. So that is a opposite thing. If it is a adoga rektapita, vamana karma is indicated. So that's why pradimarga harana, opposite line of treatment you are prescribing for the Rektapitta condition. So Pradimarga Harana Chigilsa, that is indicated in which condition? Rektapitta. Pradidwanda Chigilsa, that is indicated in Unmada. Okay, Pradidwanda Chigilsa, that is basically given for the Manasiga. Okay, like in that Manasiga, because Unmada we can get due to Bhaya, due to stress, okay, due to some maybe excessive happiness, okay, because of all these things we can get Unmada. So what is the exact cause you are getting, like because of the depression if you are getting, or because of the excessive happiness? So opposite thing if you give it to the patient, then suddenly we can reduce the symptoms. Okay, opposite of the causative factors, opposite of that mental factors. Okay, if it is fear, then give some happiness, or if it is a depression, if it is very sad person, because of that he has got this Unmada, then give some happiness. Okay, if it is an anger issue, give some peace. Okay, so that type of opposite things, like that type of chigilsa has to be given in the Unmada. Okay, Pradidwanda chigilsa, that is mentioned in Unmada. Jugulpsa chigilsa, that is indicated in the Rajayakshma. Jugulpsa chigilsa means in Rajayakshma, that in Rajayakshma what is happening? The full dhadu kshaya is happening. Right, full dhadu kshaya is happening. For increasing the dhadu, we have to give mamsa ahara. Okay, so many animals meat we have to take, animal or birds meat we have to take it for as a treatment for Rajayakshma. So most of the people, they don't take this meat. Okay, though they don't take the mamsa. Okay, very few people will be taking the all kind of mamsa. So while giving, sometimes we have to give like very it is very difficult to eat that type of mamsa. So what to do, like a physician will be telling it might be a chicken, or it might be a beef. So like that of they will be telling some another name, and they will give to the patient, and accordingly the patient will be eating. Okay, like a false thing we will be telling, like if it is a vegetarian, so we can't tell it is a mamsa, right? So we have to tell some another name and make that person to eat it. So that is called Jugulpsa chigilsa, like a false thing we will be telling and giving to the patient and making him to eat. Okay, so that is indicated in Rajayakshma. So we have to prepare the mamsa, that while giving to the patient you should tell some other name or maybe some vegetable, like that you have to tell it and give it to the patient and make the person to eat. Okay, that is called Jugulpsa chigilsa, that is indicated in Rajayakshma. Then Vyatyasada chigilsa, this is Ushna Shida alternative chigilsa. Okay, like sometimes Ushna chigilsa, sometimes Shida chigilsa we have to follow. So that is indicated in 5 conditions. Okay, Vityasada chigilsa indicated in 5 conditions. Shwasa, Kasa, Asha, Pittavrudha Vada. Next one is Vada Vyadi. Okay, Vada Vyadi, Shwasa, Kasa, Arsha, Pittavrudha Vada. Next one is Vada Vyadi. These are the conditions where Vityasada chigilsa is indicated. So these 4 points are very, very important. Next one is, that is also very important. Most of the competitive exams we can see this synonyms. Okay, Mahagada, it is a synonym of Adatwa Abhinivesha. Very, very important. Okay, Adatwa Abhinivesha, another name is Mahagada. Mahadosha Mahagadam is Madhya. Then Mahagadam, Mahavegam, Aknivat Shikrakhari is Rektapitta. Okay, so it is a Rektapitta is a dreadful disorder also, and it is Mahavega, severe Vega. It will spread all over the body. Okay, Aknivat Shikrakhari, like a fire burn will be happen. A fire suddenly it will take all the areas. In the same way, Rektapitta, it will affect all over the body. So Mahagadam, Mahavegam, Aknivat Shikrakhari. Okay, Akni, that is Rektapitta. Okay, Mahamula, Mahavega, Mahashabda, Mahabala, that is Hikka. Okay, Hikka, that will be from the innermost location you will be getting, and it is Mahavega, severe Vegas will be there, and severe sound will be producing. Mahabala with them, because in some Hikka, full body will be trembling. Okay, that much severe condition, Hikka. So it is Mahamula, Mahavega, Mahashabda, Mahabala is Hikka. Mahavyadi is Halimaga. Okay, Mahavyadi is Halimaga. So these, the last 2 points, Pradyamarga Harana, that point, and Mahagada, that points are very, very important. Sangraha Kala is also important one. Next one is Sarvavaha Sapnya. Sarvavaha Sapnya, it is also known as Sira. Jivana Sakshini Sapnya, that is also known as Dhamani. Then Mutra Margagada Shalya Nirharana Yandra. Okay, if any foreign body is present in the Mutra Marga, so how we can remove it? Susruta is telling by using Badisha Yandra you have to remove it. Vakphata is telling Sarpa Fana Mukha Yandra has to be used. Okay, so if Shalya is present in Mutra Marga, for removing that, Bedisha Yandra according to Susruta, Sarpa Fana Mukha Yandra according to Vakphata. Then Muda Garbha Gadi. Okay, Muda Garbha, in which all the ways it will be moving. Okay, movement of the Muda Garbha Gadi is 8 types. Muda Garbha Bheda, types of Muda Garbha, that is 4 types are there. Okay, Keela, first one is Keela, second one is Pradikura, Pareekh, Bijaga. Keela, Pradikura, Pareekh, Bijaga. These are the types of Muda Garbha. Types of Muda Garbha 4. Okay, next one is Balagraha. Charaka has not mentioned about Balagraha. Susruta has mentioned 9 Balagraha. Harida has mentioned 8. Kashyapa has mentioned 10. Then Vakphata, Bhava Pragasha, Yoga Raknagara, Madhava. These are all telling 12 Balagrahas are there. Next one is one shloka. Okay, Triratram Paramam Tasya Jandur Bhavadi Jivadi. Okay, so here they are mentioning that within 3 days, if you have getting this disorder, within 3 days patient will die. Okay, Triratram Paramam Tasya Jandur Bhavadi Jivadi. If this condition is happen, within 3 days patient will die. Okay, so that context has mentioned in which all the condition. Charaka has mentioned this under Rohini. Kashyapa has mentioned in Kuda Pagala Sannipada. Then Madhava is telling in Shankhaga, Trayaha Jividam Haishajyam. So in the Shankhaga. Okay, so this type of conditions are happen within 3 days, patient will die within 3 nights. Okay, so Rohini, Kuda Pagala Sannipada, then Shankhaga. So most of the time Shankhaga related questions we used to get. Okay, options, in that option Shankhaga will be coming. Then Netra Mandala, according to Susruta 5, according to Vakphata 4. Then Nabhi va Hriday ke madhya Go Puchavat Ubhara. Okay, there is a small elevation will be happening. Okay, elevation will be happening, and the size of that elevation or the shape of the elevation will be Go Puchavat. Okay, Go Puchavat type of one elevation will be happening, and that is happening between Nabhi and Hridaya. Okay, Nabhi Hridaya Madhya. So between the Nabhi and Hridaya, you are getting an elevation in the shape of Go Puchavat, that is the lection of Baddha Gudodara. Okay, then Nabhi ke niche Go Pucha Agara Ubhara. The same thing, you are getting below the Nabhi, you are getting an elevation that is in the shape of Go Pucha, that is Parisravi Udara or Chidrodara. Okay, it is a lection of Parisravi or Chidrodara Lakshana. Okay, so between the Nabhi and Hriday, if you are getting elevation which is in the shape of Go Puchavat, Baddha Gudodara Lakshana. Below the Nabhi, if you are getting Parisravi Udara. Okay, next one is Galaganda. Galaganda, there will be swelling which is happening in the our neck area. Okay, so that is in the shape of Mushkavat. Okay, Mushkavat Agridi, that is the Samanya Lakshana, general symptom of the Galaganda. If it is Alabu, in that shape, if you are getting the swelling, that is lection of Medoja Galaganda. Mushkavat Agridi Samanya Lakshana, Alabuvat Agridi Medoja Galaganda Lakshana. Okay, next one is Atmana Pratyatmana. Okay, Atmana means what? You are doing Vada Vega Dharana. Okay, Vada Vega Dharana. Okay, so because Vada Vega Dharana and again then Nidana Sevana, these two, because of these two things, what happened? There will be Vada Pragoba will be happening. Okay, due to the Vada Purisha Vega Dharana, then again Nidana Sevana, because of these things, what happened? There will be Vada Pragoba will be happening. Okay, and it leads to the distension of the abdomen. Okay, which means below the lower part of the abdomen will get distended. Okay, lower part of the abdomen is getting distended. Pain will be getting in the lower abdomen and like a gurgling sound you can hear it. Okay, so this is called as Atmana. Okay, so here Vada Pragoba is happening due to the Vada Vega Dharana, Purisha Vega Dharana. Vada is getting obstructed in the lower part of the abdomen. So it will leads to the bloating of abdomen. Okay, and then there will be pain will be there. Gurgling sound if you are hearing. Okay, these are all happening in the lower part of the abdomen. So this is called as Atmana. So in this in Atmana, Vada Pragoba is happening. So here Phalavarti we have to give, because reason is Vada Vega Dharana, Purisha Vega Dharana is happening. So that's why Phalavarti Prayoga should be given for the Atmana. Pratyatmana means you are getting like there is a distension will be happening, not in the abdomen. It is happening in the rest of the other parts of the body. Okay, not in the abdomen, rest of the other parts of the body due to the kapha dosha obstruction. Okay, there is excessive kapha dosha will be happening any else of the body, and because of that what happened? Vada will get obstructed, and because of that Vada Pragoba will be happening. And due to that you are getting distension on that area, that is called Pratyatmana. Okay. So due to the Kapha Dosha Pragoba, Vada Pragoba is happening. So that is called Pratyatmana. So in that Chigilsa is Vamana Karma has to be done. So for Atmana, Phalavarti Prayoga, in Pratyatmana, Vamana Karma has to be given. Then Nudana Guggulu, like a new Guggulu. Okay, the collected new Guggulu, that one is Mamsa and Virya Vardhaka. It is good for the Brahmana. Purana Guggulu, Mamsa, Virya, Kshabana, Karnevali. Purana Guggulu means like a 1 year old Guggulu. Okay, that is Purana Guggulu. That is usually reduces the Medo dosha. So that's why in obesity we used to give Guggulu Kalpana. Okay, Mamsa, Virya, Kshabana will be done by Purana Guggulu, and the new one it has the action of Brahmana Karma. Mamsa, Virya Vardhaka is Nudana Guggulu. Purana Guggulu is Mamsa, Medo, Kshaya will be doing. Then Abhyanga is a Kaphavada Shamaga. Okay, by doing Abhyanga, Kaphavada dosha will get reduces. By doing Udvartana, Kapha Medo Vilayana will be happening. Kapha Medo doshas will get reduces by doing Udvartana. Next, Sushruta is telling Pada Prakshalana. Okay, by doing Pada Prakshalana, we will be getting Chakshu Prasadana. Pada Prakshalana means by cleaning the Pada. Okay, by cleaning the Pada, it will be soothing for the eyes. Okay, Chakshu Prasadana. Pada Abhyanga is a Chakshushya. If you do Abhyanga to the Pada, okay, oil massage if you are doing, so that is good for the eyes. Okay, it will increases the that vision, all those things. For that, Pada Abhyanga is good. If you do Pada Prakshalana, it is a soothing for the eyes. Chakshu Prasadana. Okay, so these terms you can get. Pada Prakshalana, what is the benefit you are getting? Chakshu Prasadana. Pada Abhyanga, the benefit you are getting is Chakshushya. Charaga is telling Pada Abhyanga, it will be giving Drishti Prasadana, the same thing. Okay, so it will help in the increase in the vision. Then Paduga Dharana. Paduga Dharana means if you are wearing chappal, then that is Chakshushya. Okay, so according to Sushruta, Pada Abhyanga is Chakshushya. According to Charaga, Paduga Dharana is Chakshushya. If you are wearing this chappal, so that is Chakshushya. Okay, it is good for the eyes. Okay, so the vision will increases by Pada Abhyanga, Drishti Prasadana, that is told by Charaga. So these terms are important. Okay, so according to Charaga, Pada Abhyanga is Drishti Prasadana, Paduga Dharana is it protects the eye. Okay, Chakshushya. Next one is Aushadhinam Padi, that is Soma. Aushada Adhipadi is Chandrama. Okay, like definitions they are telling. Then next they are telling the lines of Purva Rupa. Kushta Purva Rupa, Vadarakta Purva Rupa, both are same. Okay, Purva Rupa of Kushta, Purva Rupa of Vadarakta, both are same. Sparshajñatvam adhisvedo nava. This is the line which is told in the Kushta Purva Rupa. Okay, Sparshajñatvam, there will be loss of touch sensation, excessive sweating. These type of lakshanas you can see in the Kushta Purva Rupa. Okay, same thing you can see in Vadarakta also. Svedo atyartham na va kashnyam sparshajñatvam. So there will be excessive sweating, blackish discoloration of the skin, and there will be loss of touch sensation. These are the Purva Rupa of Vadarakta. So Vadarakta, Kushta, both are having same Purva Rupa. Okay, then Sparshajnanam Kushta. Okay, like there will be related with Kushta disorder, it is a skin disorder, but along with it there is a deformity will be happening in the touch sensation also. That is Kushta. Okay, Udaramaya, that is Adhisara. Okay, these are synonymous. So Udaramaya is Adhisara, Sparshajnanam is Kushta. Then Visarpa and Kushta both are happening because of the vitiation of 7 factors. Okay, there is a 7 factors are there which is causing the Visarpa and Kushta. Samutpatto Viknyaya Saptadadavaha Visarpa Saptago Dravya Sangraha Kushta. Okay, the 7 things are getting vitiated in Kushta and Visarpa, so that they are telling in this quotation. Okay, so Sapta Dushyas are Tridosha, Tvak Mamsa Rekta Lesiga, Tridosha, Tvak Mamsa Rekta Lesiga. These are the 7 factors which is getting vitiated, and it is resulting Visarpa and Kushta. Okay, for getting Visarpa, for getting Kushta, these are the 7 things are getting vitiated. Then Kushta, Vadarakta both are having same Purva Rupa. Okay, so rest of the things we'll discuss on the next video.